Today is Wednesday, June 22nd. Kay Wagner is talking with Dr. Stephen Webster, a retired dermatologist, or a part-time.
Part-time.
Dr. Webster received his MD from Northwestern University in 1960 and completed his residency in dermatology at Walter Reed General Hospital in 1965. He has been a diplomat of the American Board of Dermatology since 1966. Dr. Webster joined Gunderson Clinic in 1971 and is still working part-time for currently a total of 45 years with Gunderson. Welcome.
Thank you.
Glad to have you here today. You grew up in Chicago.
I did.
Please tell us more about your family history, education, background.
Well, I grew up in Hyde Park on the south side of Chicago, which was a wonderful little community then. It was like a small town. We knew the butcher and the druggist and everybody and all the neighbors, and it was a wonderful way to grow up. My family had a very strong physician tilt to it. My father was the fifth generation Dr. Webster. He was a dermatologist. And so medicine was kind of a part of our family. My brother and I, he's a physician also, are the sixth generation Dr. Websters. And then my daughter, Margie, Dr. Margaret Webster here at the clinic, is the seventh generation Dr. Webster. So we're kind of stuck on the physician aspect of life. But it was wonderful to grow up there. And my father had a solo practice in dermatology, and he was just someone who was delighted with medical practice, and I was impressed with how much he enjoyed seeing patients and talking about it. I went to high school there in Hyde Park. Then I went undergraduate to Northwestern and to Northwestern Medical School and graduated in 1960. I wasn't sure what my specialty would be. I thought pathology was interesting. I considered internal medicine, and I did consider dermatology. So I finished medical school, and I decided to take a year of pathology just to see what it was like, and then I could branch out from there. My internship was in Colorado General Hospital in Denver. It was a wonderful rotating internship, and I'm very impressed with the importance of that year of graduate medical education. So I was at Northwestern, and then in the latter part of 1961, I was drafted as a physician. That was during the time of the Berlin crisis. And they were drafting doctors that didn't have a definite plan for future residencies. It was the Berry plan. And so I was drafted and entered the Army and was first assigned to Fort McClellan, Noble Army Hospital, in Anniston, Alabama. And there I was a primary care physician seeing general medical patients. And I found dermatology was really quite interesting. So I thought, dermatology is rather fascinating. Well, one of the inspectors from the Surgeon General office that routinely goes to dispensaries was Colonel Throm. And Colonel Throm was a dermatologist who knew my father. And he said, okay, what are you going to do? And I said, well, I've got 2 years obligated with my draft, and then I'm going to consider pathology or internal medicine or dermatology. And he said, you ought to strongly consider dermatology. It's very interesting. And I felt at that time it was indeed interesting. About a week later, Colonel Throm called me and said an unexpected opening in the first year dermatology residency at Walter Reed was open, and would I be interested in taking that? That was one of the best derm residencies in the country, and I said, yes, sir, I would. And so we ended up going to Walter Reed, finished my residency there in '65. We were first stationed in Germany for 3 years, which was wonderful, and then in Fort Lewis in the state of Washington at the Madigan Hospital. I enjoyed the military, and we liked the military life. However, the moving around was getting to us. Our oldest son, David, was in his fourth school in fourth grade. And Katie, my wonderful wife, said, that's a lot of moving around. And I said, yeah. And at that time, I also was informed that my next assignment would be in the command and staff training program out east for the military. And I explained to the commanding officer at Madigan that I wanted to stay taking care of patients, not be in the administrative command staff. And they said, no, we draft doctors to take care of the patients. You're regular Army, so you're in the command rotation, which I don't think would have been good for me or the Army. So we then did get out of the military. And we were looking around for where we wanted to settle down. We wanted roots. We wanted someplace that we would have a strong neighborhood. And I wanted to be in a teaching environment and clinically involved, but not necessarily in an academic medical school. And we talked around that. One of my friends from medical school took his residency with Bill Morgan in internal medicine. And he said, you know, you ought to talk to him. He is in an environment that sounds very much like what you're looking for. And so I called Bill Morgan. He talked to me and he was very enthusiastic about Gunderson and that we were looking for a place like that. And he suggested I call Dr. Rasmus, Bob Rasmus, who was kind of the personnel director for getting physicians. And I called him and he explained the program here and it sounded really good. And then he said, and my very good friend, Dr. Ed Overholt, is working hard building up the program. Well, Dr. Overholt was Colonel Overholt when I was at Walter Reed. He was the chief of internal medicine and he was the best clinical teacher I'd ever been with. And so that settled it and I said, this sounds good. And I talked to Katie and we visited La Crosse and Gunderson Clinic. I was very impressed with Gunderson Clinic as an environment that really cared about the patients, put the patients first, was very professional, and had a strong teaching program. We loved the community of La Crosse. We loved the beautiful west coast of Wisconsin. And so that's how we made the decision to come here. We started in '71, and it's been 45 great years of being involved with this health system.
Did you have a particular role model that you met along the way or mentor that guided you?
Well, in a way I did. It was kind of a mentor several generations ago, Sir William Osler. And Sir William Osler had a saying that he said, the good physician treats the disease. The outstanding physician treats the patient with the disease. And he emphasized the importance of the patient. And that is something I have told to physicians that are starting out, or I've always emphasized how important those words from William Osler was to us, because the patient is the center of what we do. And I encourage young physicians, particularly that we're having more technology and advances like that, so we're spending more time on the computer, but I emphasize them to listen to the patient, because the patient is telling you their diagnosis, they're telling you what they need, and the patient is who you are really treating. You're treating the patient with the disease. And that rings true. I think it rang true for me during my clinical years, and I think it's good advice for young physicians.
When your daughter decided to go to medical school, did you have any advice for her?
Yes, it's interesting because my wife came back from the orientation down in Madison, and she said, did you know Margie was pre-med? And that was the first time I'd heard about it, because I didn't want to push her. My father didn't push me to go into medicine, because I think you should go into medicine because you think it really is something you'd like to do, not because you're pushed by somebody. And then I did talk to Margie, and I said, Margie, you're going to love it. There's no better way to spend a life, and you're going to be terrific, because she's a very nice person. She takes after her mother, so she has a very nice way of getting along with people. So I knew she'd be an outstanding physician, which she has, and it's been a true privilege to have the opportunity to practice medicine with Margie, Dr. Margaret, although occasionally at about 4 o'clock on a Friday afternoon, my nurse would come in and say, "We've got one more patient to see." And I say, "Well, we got an extra patient?" She said, "Dr. Margaret wanted the patient seen." So I saw it because Dr. Margaret, the nurse knew Dr. Margaret had something over me, so I would see the patient.
Was this her first position here at Gunderson?
Yes, yes.
And did she choose it, in your opinion, for the same reasons that you did?
I think we encouraged our kids to, I can't think of a better place to live than La Crosse, Wisconsin, but I think it's good for young people to get out and live someplace else so they see the facilities that we have and the lifestyle that we have and the work ethic that we have here. So I kind of encouraged her. She took her residency down in Chicago and so on. So that gave her an opportunity. But yes, I think she wanted to come back here because she thought it was a good place to bring up a family.
Well, you've talked about what attracted you to Gunderson. How many clinicians were here when you joined the clinic? Do you remember your number?
I believe I was the 34th physician that was practicing at Gunderson in 1971, and it was a different environment. You'd see every other doctor every day. If you wanted a consult, you just mentioned it to them. The receptionists all knew each other. The nurses all knew each other. So there was a real interaction that was very nice to work with, and it was a wonderful opportunity. All the doctors took call in the emergency ward. I took call in the emergency ward, which scares me now, but back then, really, in the emergency ward, you had to have common sense. You had to know when to call a specialist in, and you did get to know to everybody then, too.
Mm-hmm. Was it a challenge to come to a clinic that was primarily Gunderson's at the time?
No, I was just impressed with it. It was a clinic and a health system that was run by the physicians. One of the problems I'd seen in some health systems is they were more or less run by administrators and business people. And when I came to Gunderson, this was strictly run by physicians. And I remember my first couple of months, every single week, either Dr. Ottoff or Dr. Sig Jr. would drop by the dermatology clinic and see if I had anything I needed, is there anything else you need, and so on. And I was just so impressed with that. And then when I had the privilege of being vice president of Gunderson later on, I saw how really the decisions that were made by physicians in the best interests of the patients and health care. And then we had advisors from a business point of view to say, okay, this is how you can put it all together. So that was one of the biggest things that impressed me about Gunderson.
How has dermatology advanced in your career, moving on to a specialty?
Well, a great deal. Because, for instance, in the treatment of psoriasis, when I was in resident training in the early 60s in dermatology, treatment of psoriasis was usually the Geckerman regime, which meant using a very greasy, odoriferous coal tar solution that was put on the lesions, and then the patient would have ultraviolet light treatment. And it was very effective, but we were treating the symptoms of the disease. Now in the treatment of psoriasis, we have biologics, we have immunotherapy, we are getting at the cause of disease. So instead of just treating the symptoms, we are treating what makes the disease abnormal, and we're able to fix that up much better for the patients. This is true in all specialties, but that's an example in how dermatology has changed. So we're a little more active and have more opportunity to really change the process of the disease, not just treat the symptoms.
How has technology impacted your specialty?
A great deal in the development of particularly targeted immunotherapy and things like that. So we have better treatments available for things such as metastatic melanoma, which we could not treat much at all before. Now we have the ability to actually target the immune system so it works against the metastatic disease.
Dermatology probably works close with plastic surgery as well, and other departments?
Oh, very definitely. the otolaryngology department, the plastic surgery department, general surgery department. They all work very closely with dermatology in regards to treatment of cancers. On the other hand, internal medicine department works very closely with dermatology, because in dermatology we are treating the skin, which is obviously on the surface, but it is affected by what's going on inside. So internal medicine is a great part of dermatology also.
Anything else about your early career or your experiences with Gunderson before we move on to some other items?
I think just how much I've appreciated Gunderson administration supporting me as I worked with organizations like the American Academy of Dermatology, being clinical associate professor at Minnesota and Wisconsin, activities outside of Gunderson that are very important to our professionalism. But I was very supportive in the time I was away from the practice. That made a great difference to me.
How many dermatologists were on staff when you were here, or when you started?
One dermatologist, Dr. Getz.
Okay. And then how many were added over the years?
Well, we're at a total of 6 now. We're looking for more because we're very busy. That's the demand for dermatology has increased because we have so many branch clinics and so many other clinicians involved with patients, and they do need dermatology consultations. So we're always looking for new dermatologists. And this is an area that I was particularly pleased with, because at the American Academy of Dermatology, I was able to get involved with the American Academy of Dermatology as a professional organization. I was secretary treasurer and then president of the academy. My father had been very active in the Academy of Dermatology. And this was something that I got a feeling for practice of medicine across the country in other areas, so I could see how important it was for dermatology to interrelate with other specialties. And I found that our relationship here with other specialties was very close and very positive, where in other larger cities particularly, they would be viewed as kind of competitors for the patients, whereas here we were working together for the good of the patient. And I saw that in other areas of the country as I worked with the Academy of Dermatology, and I could see what a great health system we have here in La Crosse.
That's a good segue into the next portion of the questions. You were very active in both the American Academy of Dermatology and the American Board of Dermatology, including president for both. Tell us about those leadership roles and your experience.
Well, again, at the Academy of Dermatology, I was very honored to be secretary treasurer and then president. My father was actually president of the American Academy of Dermatology. He passed away when he was president of the Academy. And the Academy of Dermatology and my activities there allowed me to see how dermatology could best interrelate in the overall healthcare system across the country. And that gave me the opportunity to talk to people that were in academic roles, that were in private practice roles, that were in a clinical, multi-specialty clinic like I was. So I was able to bring that all together, and that helped a great deal when I was vice president of Gunderson Clinic here, because I could see the strong points of the other areas and kind of work to make our system stronger. The American Board of Dermatology was the certifying body, and that, I think, was one of the most satisfying professional positions. I was named to the board of the American Board of Dermatology, responsible for making up the examinations in the certification process, and then I had the opportunity to be the associate executive director of the American Board of Dermatology, so I was involved in the involvement and making sure the tests were targeted in the right direction, making sure that the programs that our candidates were in were giving them all the information they had. It was a very satisfying professional organization. And then being clinical associate professors down at Madison and at Minnesota gave me the opportunity to work with the academic part of dermatology, and I enjoyed that. And again, I was very supported in those areas by the administration of Gunderson, so I was very appreciative of that. That all brought everything together, and again made me realize that we really had the best of all worlds in that we have the center is the patient, and if the patient needs a consult with another specialist, he goes there. If he needs a test, he or she, then we get it for him. And so it's a neat system, and I was very proud to be a part of that system. I have to tell you one analogy I have with a physician of my age at 80 and having been here for 45 years about how I saw growing with the clinic. In biology, and I heard this from a biologist, as a tree grows, when it's very small, all the cells that are in the trunk of the tree are very active in carrying nutrients and water and so on up to the leaves. As the tree gets bigger in width, the older cells in the middle become less efficient in carrying water and nutrients up to the trees, but they become much stronger. Whereas they're in the center of the tree, and they give strength, and they kind of get a little more dense, so they're giving strength to the tree, while the newer cells at the margin of the tree are very efficient in carrying water and nutrient up. So that's how a tree, and to some extent, I see old fogies like myself who have been around for a while being that center of the trees. We're not as good as on carrying all the information and the technology changes and everything up, but we have something that perhaps adds a little strength to the system as a whole. So that may be overly looking at biology and our environment here, but I think in some cases that may be a good simile.
Mm-hmm. It does. It sounds very. It reminds me of the whole mentorship process. That you practice and you get to a point where you become a mentor and a teacher, and I think that's so important. Satisfying.
Absolutely. You learn a great deal when you're actively teaching because you're getting input and you are learning a terrific amount. That's why I definitely wanted to continue active teaching, but sometimes in the very academic environment, I don't think the teacher gets as much from the other people because here there's more interaction with our residents and with our house staff and so on than you see in some of the medical schools. Actually, Dr. Margie did take a clerkship during her medical year here at Gunderson when she was in medical school. And she said, boy, I just had such a great experience in being a medical clerk at Gunderson, much more than the medical clerks in medical school get in the way of responsibility for patient care. She said, I felt I had a lot of responsibility. Now there was a staff doctor kind of hovering in the background, making sure she was doing it right, but she felt she had a lot of responsibility for patient care, and that is true of the program we have here.
You were also involved in instructional leadership roles, as you mentioned, as Vice President of Gunderson from 84 to 88, and the recipient of the Founders Award in 2011, just to name a few. What are some of your memories of your work in these roles?
Well, I think the Founders Award is probably the achievement that I had that meant the most to me, because that is so special in tying the foundation, the work of the foundation, with the work of the clinical aspect of our world. And that meant so much to me because it really is what we're all about. And the trophy itself is the picture of the gun. It's like the Gundersons in front of the building of the gun, and it kind of brings it all together. And so my time on the foundation was something that I think made me much better adapted to the clinical environment. of the Gunderson Health System. The foundation is truly the heart and soul and spirit of the Gunderson Health System.
You and Nurse Diana Hanno, is that how you pronounce her
Yes.
last name? Spent many years talking with high school students about sexually transmitted diseases. Describe that experience.
That was a wonderful experience because I trained in the military, and one of my subspecialties was sexually transmitted diseases. And it's something that it was very difficult to talk about. And I became impressed with the fact that sometimes younger people don't have much education about sexually transmitted diseases. And it is so very important. Sexuality is a very important part of our lives. And it's a very positive and a very beautiful part of our lives. But I had several patients who contacted a sexually transmitted disease, and there was nothing very beautiful about their sexual experience. So Diana and I felt it would be good to bring this education to the schools. And we presented this to the school board and said we would like to do this. And they really hemmed and hawed a little bit. But then they thought, because the health educators were just starting to be established in the school system, and the health educators said this would be great. And so we had the opportunity to go out and talk to the students about sexually transmitted disease, emphasizing that they are infectious disease, but that sexuality is a very beautiful and a very powerful and a very important part of our lives. And so we always emphasized that aspect to them. And then Diana would take the girls for a question period, and I'd take the boys, because it was difficult for them to ask questions, and we got some very good questions. In fact, Diana came back from her first couple of sessions, and she said, "Boy, it is not too early to start this." We started it, and we did it in the 7th and 11th grades. And those were very important years, and the girls were and the boys were just starting to get involved in that, and they had some very good questions which we felt were positive. And it was an interesting time, and it was kind of interesting because I do remember we were at a party someplace, and one of the teenage girls, we were standing there talking to people, and she came up and she said, "Oh, there's Dr. Webster. He was my teacher and my doctor for acne." And they wanted to emphasize that it was acne and not anything else. So we got our message across to them, I guess.
Is that still continuing? Was it picked up by the educators?
I think it's picked up to some extent by the health educators. I don't think there's any physicians doing it so far as I know. And I think it did help a little bit because we were able to talk to them and so on. But I think the health education now in the schools is much more advanced than it was back when we started in the early 70s.
Yeah. I listened to you talk about respect at the Feminism on Tap when it was at the Cavalier, maybe 6 months ago or so, and that relates back to your experience in the military, I believe, and I just was interested to hear about how that came about, and it would be interesting to have you talk about the relationship with respect.
Yeah, the school board, it took a little talking, and we had to spend some time talking about our background and everything like that and so on. But I was very impressed with the school board. They did look at it from an educational importance to the young people.
Anything else about anything we've talked about here that you'd like to add?
No, I can't think of anything else except that it's just been an incredible experience for us to be in La Crosse for the 45 years. We have such close friends, and our kids and everything. It's and I'm so proud of Gunderson Health System and my colleagues. And the other thing I'm so proud, and I say the whole system, because I find that I'm very concerned and oriented on the patient as my nurse is, but our receptionists, our secretaries, the administrative staff, the medical assistants, everybody in the health system is so keyed in to providing the best care for the patients. That's, I think, the most satisfying aspect of what we have going on here.
What do you think promotes that? Is it administration? Is it something that we have seemed to learn or integrate throughout our time here? Working here I worked here too, before coming back. So I wonder what instills that.
I think part of it is the Midwest respect and how we live, what our standards are. As I say, in the military, we had the opportunity to live on the East Coast, the West Coast, Arizona, or Alabama, and Europe, and we saw all different areas. And my wife's from Michigan, and I was from Illinois, and we found that the Midwest ethics, if I may say that, and caring for each other was very strong, and I think that's what we see. And I think the fact that these are our neighbors that we're treating, it's our Midwest people, and I think that's what really made that strong feeling, and then it kind of feeds on itself, and everybody is involved with that. So we all say, okay, the patient is what we're here for, and we're going to do what's necessary for the patient. And I think part of that, and I think when you go to the grocery store, when you go to the schools, when you go to the church, you find that respect of Midwestern people have for each other. I remember we'd been here for about 10 years, and I was down in Chicago. My brother was a physician there, and I was driving, and I forget where we were, but it was quite busy. And we were stopped, and I motioned several cars in front of me to go ahead, go ahead. Well, the people behind us just laid on their horn. And my brother said, we don't do that in Chicago. I said, well, in La Crosse, we do. At a stop sign, we will motion people across, and I just wasn't even thinking about it. But Jim said that wasn't quite true in Chicago, so I heard some horns honking behind me.
You've authored 37 publications in 2 chapters. How did medical education and research affect or enhance your practice at Gunderson?
Oh, I think it just, that tied into I wanted to be the best doctor I could be. I wanted to make sure I was keeping up with other advances in dermatology and in medicine, and that's another area that the Academy of Dermatology, as a professional organization, they have multiple continuing medical education programs and courses and symposium and so on. And that helped me to stay where I should be in medicine, stay up on the latest advances and so on. And that's so important today, and because it's getting even more advances going on now. And that was one of the factors that when I did stop seeing patients 6 or 8 years ago, I missed seeing the patients, but I really felt there was so much new treatments and so on that it was time for me to step back. And now I'm very, very satisfied in doing the skin cancer screenings, which I'm doing, talking on sun safety at local businesses, doing the skin cancer screenings at local businesses and at branch Gunderson clinics and so on, because I think it's getting the word out about sun safety and our concerns about skin cancer and so on. So even though I miss seeing the patients, I feel that that is helping the overall system to be a little bit better, because that's getting education out to the patients.
In terms of your research, 37 publications in 2 chapters is also very impressive. And were you given time or a half a day or allowed time to do your research, or was something that you did on your own time?
A little bit of both. I did some on my own time, but certainly my time down at medical schools in Minnesota and Madison, that was time that I had. And many of the papers that I wrote, I was a co-author with other physicians at Gunderson Clinic, so it was something we kind of worked on together. So it was very much a team process. Very few of those were just Stephen B. Webster, MD. It was they were case reports and things like that I did with other colleagues.
Thinking back to your tenure at Gunderson, what would your colleagues say that you are known for?
Oh, I think, I hope they would say I took good care of dermatology patients. I'm sure they would say I continually harped at people about using sunscreens and wearing hats and things like that. They used to say, oh gosh, here comes Webster, we better put some sunscreen on, or say we did and something. I think they'd remember that. I think that's what I primarily would like to be remembered, hopefully as a good colleague to them.
Putting the patient first.
Putting the patient first, absolutely. And seeing consult with them and continue to following through with the patients. That was one nice thing that we could do. I think being president of the Academy of Dermatology was fine, but I don't think that was an important thing. That is a part of my caring for patients and being a colleague to them is the important part. And as I look back on my many friends and colleagues, these were true collegial partners in the professionalism of healthcare.
Do you have a favorite story about Gunderson, maybe a miraculous day, patient that you remember, proudest day, any of those that pop out in your...
There's no real big ones, but as I mentioned before, the fact that I started my dermatology clinic, which originally was on the first floor where the pharmacy is now, both either Dr. Adolf or Dr. Sig Jr. would come by once a week and make sure I had everything I needed. And to me, that just was an image of how the cooperative and the support that I would receive in 45 years at Gunderson Clinic. So I can't think of any one particular day. I still see patients that I've seen, and they are still fun to talk to and so on, and it's great to remember with them and so on. So again, that relationship, I think, but that was something that would happen every day. I can't think of one day that was a shining memory.
You offered this in, I think, the email that you sent yesterday about the words of wisdom going back to Sir William Osler. Maybe you want to touch on that.
That was really big, and that was actually, I had an attending staff man at Cook County Hospital in Chicago when I was a medical student, and I forget his name, and I've been trying to remember it. He was an English doctor, and he was just fantastic as we dealt with. Cook County Hospital was the big charity hospital in Chicago with a wide range, and he was the one that talked about Sir William Osler and how important the patient was. And watching his relationships to the patients, he was very British and he had a wonderful accent, but he would relate to the patients, and we would see patients in a big ward of 38 beds. It was one big room with 38 beds, but we would be talking to the patients, and he was very personal with every single patient and encouraged us to be very personal. So I think that's the type of thing that stayed with me over the years. I wish I could remember his name, but I just can't. But he was a delightful English chap. And the other person that I was very impressed with is kind of interesting. Nancy Davis was the daughter of Dr. Loyal Davis, who was the chief of surgery at Northwestern Medical School when I was there. And he was a very, very good teacher. And I remember one time with Dr. Davis, there were 4 of us that would rotate together through surgery. And one of my colleagues, one of the other medical students, put a hand down on the surgical table and contaminated the whole thing. And so they had to shut down and clean the whole room and so on. And Dr. Davis heard about that, and he said, okay, you 4 people, I want you to meet me in the lobby at 4:30 after you've changed out of your scrubs and everything. And he didn't say anything more. And he said, oh, sorry, Lord, what's going to happen? Well, Dr. Loyal Davis, who was the chief of surgery, took the 4 of us out to dinner at a very nice restaurant and talked the whole time about the importance of professionalism and building up so you know all aspects of medicine. And his daughter, Nancy Davis, worked with us on what we called Quo Vadis Medicus, which was a medical musical show that would be put on each year by the medical students. Well, Nancy Davis subsequently married Ronald Reagan and became Mrs. Nancy Reagan. And I had the opportunity when I was in Washington to meet President Reagan and Mrs. Davis. And I mentioned to Nancy, I said, do you remember those days? And she said, oh, yes, my goodness, I remember those. So I had a nice chat with her. And when President Reagan passed away, I sent her a note. And I said, I just want you to know that your father was a very influential person in my education, and particularly in my aspects of professionalism. And she wrote me back the nicest letter. She said, oh, that was so nice of you to write that. A lot of people thought he was kind of hard on medical students. Well, he was kind of a SOB, in a matter of fact, but he taught a great deal. And she wrote this wonderful letter that I treasure, because she said so many people thought he was too strict on medical students, and the fact that you appreciated and so on meant a great deal. So I thought that was an interesting relationship with my medical school time and with the later Nancy Reagan.
And yet the gesture of taking you out to dinner rather than an admonishment for the 4 that were there, it seems like a grand gesture.
It was perfect, because it was the whole evening was positive. We thought we were just going to get chewed out. Mm-hmm. And therefore the message that he told us about the professionalism and how that's part of our soul meant a lot more to all of us. All of us remember that night. We've talked about it frequently.
Dr. Overholt ran a tight ship too. I think you hear so much respect for him. I'm sure that you have stories about him as well.
In exactly the same situation, because he was a colonel and I was a captain, dermatology resident. But the interaction was very positive as colleagues, and it was obvious. And he remembered names. He remembered aspects about what you were interested in, particularly, and what you did. That was exactly the same type of atmosphere that he and Dr. Davis. And again, Colonel Overholt, and I still call him Colonel Overholt. I called him Colonel Overholt even when he was here. I forget the number of doctors who are at Gunderson who are here because they had had contact with Colonel Overholt previously. And so that, for a lot of us, we have that in common, and it's the same thing. He was a teacher, but he was a colleague, and he was a friend, and that's a great educational environment.
What are you doing in your semi-retirement?
Well, as I say, I'm really pleased doing the skin cancer screens and the education about sun safety and so on. I have a wonderful camaraderie and friends. I am a past fest master with Oktoberfest, and I have a whole different group. And that's a wonderful group because, like the other group I have, I started playing the bagpipes, and then I worked into a drumming situation with the La Crosse and District Pipes and Drums. And both the La Crosse and District Pipes and Drums and Oktoberfest are made up of a very eclectic group of people. They're all different. And when I go to medical meetings, I love my physician colleagues, but we all tend to be somewhat similar. We're all a little type A and the same type of thing. Whereas the bagpipe group in Oktoberfest is just a total eclectic group with different people. And so that's been very good for me because I got to know a whole different type of people. And with those people, both in the bagpipe and with Oktoberfest, we've worked hard in community projects and things like that. So that's brought me out into the community. So those were important areas. At church, I taught fourth grade Sunday school for 38 years at the First Congregational Church, and I enjoyed that a great deal. That was the year they got their Bibles from the church, and I think everybody should read the Bible with a fourth grader because they don't have our prejudice and our hang-ups, and they can see what it said. They knew exactly what Jesus' parables were all about and so on. So that was very rewarding. And just working in the communities, my wife is the coordinator for mobile meals through the church. And so again, through that, we have reached out to the community with the Mobile Meals organization. So all of those things have been a very positive part of my life.
Lots of energy.
Well, it's fun to have energy.
No, it's impressive. You are a big supporter of the foundation, and established the Webster Griffith Director of Transitional Medicine Endowment in honor of your fathers, who were both physicians. And we thank you so much for your support to the foundation. And can you tell us what the foundation means to you?
Well, the foundation means continuing to support education. And a very important part of medical education is the rotation, the flexible year, the internship as we used to call it. And that is so important. And Katie, my wife's father, was Dr. Lucian Griffith. He was a solo practice OB gynecologist in Grand Rapids, Michigan, and my father was a solo practice dermatologist in Chicago. And both of them were very active in education. Even though they were solo practitioners, they were very involved in education and in the professionalism aspects of medicine and working to improve that. And so we felt we would like to help that flexible year of the internship year, I still call it. And we've been very pleased to work on getting that because I think that's a very important part of the overall education of a doctor after he leaves medical school, that first year where he rotates and sees all aspects of medicine. It's what I had at Colorado General Hospital and was so valuable to me when I had to be a primary care physician in the military a year later. So that's very important, and we've been honored to work with the foundation, and the foundation people are so dedicated to supporting the Gunderson Health System. It's just been a pleasure.
Very strong. You work with rescue dogs too, is that correct?
We have had rescue dogs always. Our current rescue dog is Seymour. Seymour came to us about 4 months ago. Before them, we had Luther, and Luther was a wonderful rescue dog who's from Humane Society and was with us for about 6 years, so we've been very supportive. Margie, Dr. Margaret, is very active in the Humane Society. As a matter of fact, one of the dogs that we had when she was with us was Harold, who was a rather ugly-looking mongrel that she brought home from the stables where she had her horses because they were going to just get rid of Harold. So we adopted Harold before Harold got given to the Humane Society. So I think Dr. Margaret started us on this rescue dog aspect, and she still has rescue horses. Oh. She has 3 horses that she has currently, and one of them was a horse that was with an Amish family, and when the horses would get old and couldn't pull the wagons anymore, they would be kind of sent to the, quote, glue factory. And so she has adopted some of those horses. And a couple of them, I believe one was a racehorse who was too old to racehorse, but she keeps them and stables them and grooms them, and so she keeps that feeling going. So I think a lot of what we feel, Katie and I feel about our rescue dogs and everything kind of comes from Margie, because she taught us how important that is. She was very active in 4-H when she was in high school.
And your other children?
David, our oldest, is in Eau Claire. He is a certified athletic trainer and has really enjoyed that a great deal. Our youngest son, Jim, is a fish biologist, and he was with the DNR here in La Crosse for quite a while, and then the Fish and Wildlife contacted him, and he's now with the Fish and Wildlife people in Green Bay. And he was contacted by them because when he was out on the state of Washington, he worked for a company that developed a robotic tagging system for fish. It was developed for the salmon, where they could tag the fish, and he was active in the development of that process and very much involved with it. Well, the Fish and Wildlife people wanted to get that same tagging system going in the Great Lakes, so they contacted him. So he was enthused on doing that, so he took that system and uses it on the Great Lakes, and they live in Green Bay now, and they love Green Bay. They live in De Pere, actually, and they love it, and their daughter is an avid Packer fan, and he enjoys working as a fish biologist with the Fish and Wildlife. It's a very varied job, and he travels a lot with it, and he really enjoys it.
And where did you meet your wife?
My wife, Katie, remember her father was a physician, and she was a teacher actually in Evanston. And she was a roommate to the fiance of my anatomy partner at Northwestern, and Vic Soloff. And one day we were dissecting our cadaver at Northwestern in the anatomy lab, and he said, "What are you doing Saturday night?" And I said, "I don't have anything to do." He said, "Why don't I set you up with a blind date with my fiance's roommate?" And I said, "Fine." Well, I met Katie, and it turned out Katie had a real job, a television set, and a '57 Chevrolet. So it was love at first sight, and it really was. She also was someone that I felt immediately attracted to, and we just, because of our backgrounds with our parents, we had so much similarities. It was very special, and so I was very honored to have her as my wife. Actually, Loyal Davis again affected our, because when I asked her to marry me, she said yes, but she'd really like a Christmas wedding. And I was on a surgical clerkship on surgery on Dr. Davis's at his hospital. And Dr. Davis did not particularly think medical students should be married. So I said, Katie, could we put it off until April when I'm not on surgery anymore? And she said, sure. And so Dr. Loyal Davis did affect us in that time, because Dr. Davis didn't feel medical students should be necessarily married.
Did he think it was a distraction?
Yes. Well, he didn't. He was pretty conservative, yeah. And I was a junior medical student, and his idea that's a full-time job and you don't have time to get married. Mm-hmm. But I'm sure he would have been very supportive of Katie. He would have liked her too.
I don't have anything more. I usually ask Dr. Eric for his thoughts, and I'm trying to find that email that he sent, which I probably will not put my hands-on very easily. So, well, I'm kind of ruffling around here for that. Is there anything else that you would like to?
No, I hope I haven't talked too much.
Oh, it was a wonderful interview. I love your energy.
Well, maybe I'll take a swig of water.
Yeah. That's what I did with that. Jay?
Well, I'll tell you, Dr. Eric, too, and I don't know what he said in the email, but I am just so impressed with him and all he has done and continues to do for Gunderson, because we will get a personal letter from him thanking us for this or that. And I've talked to so many people that meant so much. To get a call or a letter from Dr. Eric was everything. And Dr. Eric is a living example of this professionalism and the caring for the patient and so on. He was a true early. He was one of the cardiac surgeons very early in the game, and he did so much for that specialty, and he did it in a quiet, unassuming way. It was very impressive, and he is the spirit of Gunderson as far as I'm concerned.
His email, one word stands out: a man of gold. And he'd also talk about your immense support for the foundation.
Well, he is a man of gold. I don't know if I'm a kid of gold compared to Dr. Eric. I'll tell you, he is, and he's such a personable person. And he was so, with the patients, he was wonderful. He was just so good with the patients. And as I say, he was a pioneer in many aspects of cardiac surgery.
Wonderful. Jay?
Could you trace the evolution of sun safety from when you started here till now? And you can answer. Because going back to the 70s, I don't remember anything about that. I was in high school, graduated 71, so
Well,
talk to
sun safety is very important today, and I will have to say that Dr. Margaret, who was known as Margie back in her high school days, was a sun goddess like all her friends were. And there'd be a trail of baby oil going up the steps, and she'd say, "Oh no, I haven't been outside yet." And she was, and she really, and I saw that, and that's the way she was, and her friends were tanner than she was. And so that's something that I said, boy, that is very harmful. And I have to admit, when I was a teenager, I never wore a shirt and never wore a hat, and I had several sunburns, and so that stimulated me that I really have to get the sun safety word out. And also, her children, my grandchildren, are very good on using sunscreens, and we are seeing that today in that the current parents who were sun worshipers when they were teenagers, their kids are all very good on using sunscreens. So I have seen that, and I think that is going to, skin cancer is one of the cancers that has been increasing in incidence. I think we're going to see that leveling off and going down because their kids are doing everything that I want them to do because they're seeing their parents doing it. So
Following up on that, I mean, I was a sun worshiper too, but there must have been a national effort or an awareness that happened at some point, that came to realize how dangerous the sun was on the skin. And I'm wondering too, when did that seem to get legs and become a national type of issue?
the American Academy of Dermatology was very instrumental in that because they have a program now that said the SPOT program about encouraging people to do self-examination of the skin, analogous to women doing breast self-exam. If a woman is used to examining her breast, she can tell if there's a new nodule or something, go in and have it checked. We are encouraging people to do skin self-examination. We have emphasized to people that the only thing that ages the skin is not chronological years, it's sun exposure. And we tell our patients when they're taking a shower, look at the skin here and look at the skin on their thigh. The skin on their thigh doesn't have wrinkles and doesn't have the freckles and so on. It's on the face, and that's from the sun. And also the incidence of skin cancer has been increasing. 1 in 5 Americans will develop skin cancer. There are more skin cancers every year than all the breast, lung, colon, prostate, kidney cancers put together. And that information, the Academy has gotten that out to the information, and it is making a difference. But I'll tell you, the aspect of aging of the skin makes more of an influence on a teenage girl than does telling them you might get skin cancer. Because for a teenager, skin cancer, I'm not going to get that. Somebody else will get that. But if we say you're going to have increased wrinkling and you're going to want to have a facelift or something like that, that hits home. And so all that, I think, has made a huge difference here. And my Margie is a great example of that. She was a sun goddess. Her kids are terrific in regards to sun protection, and I'm sure their kids will be terrific too. So I think that's the change we've seen. And the Academy of Dermatology was very active in public education about sun safety.
If you went back 50 years from now, what would have been the largest dermatological problem or issue that doctors saw?
Oh, gee, there were so many. But they did see a lot of skin cancers, and they didn't have the new surgical procedures that we have now, like the Mohs surgery, where it's controlled removal of the cancers. They didn't have as much knowledge about the early diagnosis of skin cancer, so I think that's the biggest change.
And psoriasis, as you
And
talked about.
psoriasis, and the other things like atopic dermatitis and eczema, we can really control very efficiently now. Back then, it would be something that would very much hamper an individual and how they could get out in public and have reaction with other people. And I know one thing that I learned from Dr. Harmon, who was Colonel Harmon and teacher at Walter Reed. When you're first introduced to the patient, always shake their hand or touch them in some way, because many patients with psoriasis, they're used to, because of their psoriasis, they will sit down on a bus and people will just kind of scrunch away from them. So he said it's very important. That's one way, that just contact them, shake their hand, because many of them, when they have something like psoriasis or severe eczema, people don't want to shake their hand. They don't want anything to do with them.
They think you'll catch it.
And exactly, and Colonel Harmon emphasized that to us, and I do remember that today. And I think now we're able to control those conditions much better. But, you know, people think, oh, eczema and dermatitis, that's not serious. But for the person that has it, something like acne, a young girl with acne, you have to understand how important that is to them. It's not life-threatening, but it does affect how they relate to other people and how they view themselves. So it's very important.
Anything else, Jay? I have some pictures for you that I
Oh, that's
medical
Luther.
media
That's Luther.
was nice enough to make these pictures.
That's
for you.
Luther. That's Luther. And Luther was a fascinating dog. He's the biggest lab. We've always had labs, but he was the biggest we ever had. And he loved people, and he was dog aggressive. He couldn't be around other dogs. And they thought possibly at the Humane Society, they thought maybe he had been with somebody in the dog fighting business, because he was huge. I mean, that's a big dog. He
Yes.
weighed 104 pounds. And he, as I say, he was the gentlest. He loved people, but he was dog aggressive. He couldn't be around other dogs, which is very, and Seymour loves dogs and people, as most labs do. But Luther didn't, and they thought maybe he had been involved in someone who he was trained to be a fighting dog. You always wish, with all our rescue dogs, wish they could talk and we could hear where they came from and so on. I think they'd have some real stories. These are beautiful. Oh, and that's my backyard railroad and my garden railroad in
Well,
the
I
background.
thought you'd
there.
like those.
Oh yeah, those are wonderful. Thank you very much.